Dr. Dan Edney joins us this morning. Dr. Dan, the medicine man, always a pleasure to visit with the state's chief health officer with the Mississippi Department of Health. Dr. Dan, good morning to you.
Hey, good morning, Richard. How are you doing?
I'm doing well. Thank you. Appreciate
Excellent.
you coming in. Good to see you bright and early to start a new week.
Always glad to be with y'all.
Flu shots. I had somebody tell me a couple of days ago that the effectiveness of flu shots this year may not be what it has been at times in recent years. I know you are, at least in the past, at least have always been in favor of getting that flu shot if it's available to you,
Yeah.
or wherever it's available. What can you tell us about flu shots this year?
Yeah, there is a different strain that we're seeing at the beginning of flu season. It emerged in South America towards the latter part of their flu season, so it was not picked up in time to incorporate into our formulation of the flu vaccine. And that's how we come up with our formulation every year. The flu just constantly shifts year to year, and we look at the opposite hemisphere and see what's going on because their flu season's before ours. However, it is still effective in terms of the other typical strains that we're going to see, and it still helps mitigate, that more aggressive strain. So, the flu shot always is one of our vaccines that may not keep you from getting the flu, but it sure keep you from dying from the flu. Yeah. And I've been taking my flu shot since I was in medical school in the 1980s, and I can't remember the last time I had a case of flu, despite, examining flu patients constantly every flu season.
One of the things that has been pretty effective in recent years is if you feel like you have the flu and you get to the doctor fairly quickly, there are some medicines that you can get that can knock it out way faster than what we traditionally think of. Because there's that cold that makes you feel bad, and then there's the flu that knocks you out and puts you in the bed for a week. Those are not the same things.
And that is a key point. When it always triggered me as a pricing doctor for over 30 years when people kept saying the flu shot gave me the flu, when it is scientifically, medically impossible. There is no live virus in the shot. It's viral particles. But you can have a mild vaccine reaction, have some fever and aches, but that ain't the flu. A bad cold is not the flu. And when you have sure enough flu without any vaccine protection, you're going to be in bed for a week. And I just always chose not to be in bed for a week, so I took my flu shot. Now that I'm 64, I choose to take it so that I don't wind up sick in the hospital.
Yeah. Zofluza, is that the most common thing that people are getting now?
Yeah, and Tamiflu, if you have the flu, will really shorten the duration. So we have 3 different formulations of the vaccine, including an intranasal version for those who really don't like getting shots. Yeah. And then we have 3 different formulations of actual treatment antiviral for influenza.
One of those things, though, that comes into it's a factor if you go with Zofluza or with Tamiflu. Those are really expensive, and we talked about we talk all the time about the rising cost of healthcare. That's one of those things where it's going to be effective if you need it, but you got to be ready because it's a little bit of sticker shock.
Yeah, Tamiflu is much less expensive. It's been around a lot longer than Zofluza, but you have to take it for 5 days. Zofluza is that single dose and you're done. But it's I'm just grateful that we have effective therapy.
Absolutely. Dr. Dan Edney, State Health Officer, you recently had a briefing with Congress. Is that correct?
Yeah, I was really pleased that I was invited by the March of Dimes to come to Washington early last week to participate in their congressional briefing for mainly infant health, infant mortality, and the reason they did that was not because we scored last again, which we knew we were, with infant mortality and with preterm birth, but because they were really interested in the innovations that we were bringing to bear to attack the problem. And as I have been saying for the last 3.5 years, y'all, we have talked about this enough. We have studied this enough. We've got to do something about it, and we have to do it in a way that makes sense for Mississippians. And as we have been developing our strategic plan for mitigating infant mortality, it really has gotten national attention, and I was really pleased to have a chance to be part of that congressional briefing.
What was that like, sitting in one of those briefing rooms and I guess being grilled or at least allowed to talk a little bit? Maybe not as contentious a briefing as some of those are.
Not at all. It was sharing information, and it wasn't a specific committee. It was both Senate and House members and their staff and lobbyists. So an opportunity, for the March of Dimes to present that national data. Y'all had Dr. Michael Warren on the show very recently, who did a great job updating everybody in terms of where we are nationally. But for me to have the opportunity to say, okay, here's what we're doing in Mississippi because Mississippians care about this. And I would say of all the things that I talk about to groups all over the state, which is one of the greatest blessings of my job, is this item here gets the most attention from the groups I speak to and the most questions about, okay, what do we need to do about this?
We also had Sam Creekmore on not too terribly long ago from Mississippi House of Representatives, and he's the chair of Public Health
in the House. Yep.
In the House. And one of the things that he talked about was this program from Michigan where they have explored cash assistance to expectant mothers and said that the numbers pointed to a direct correlation to the financial burden not being as high and therefore leading to better outcomes with regard to infant mortality rates. How much have you talked with Representative Creekmore and others about this program, and is it one that you think makes sense exploring further?
Yeah, that's the RX Kids program in Michigan, and they, with the declaration of the public health emergency that we made in August, we've had 2 legislative hearings about infant mortality. So I've been very pleased about the increased awareness at the Capitol about this really important problem. And at Chairman Creekmore's hearing, he had them present that program, and just so we could hear how it worked in Michigan. The data is very impressive in terms of their outcomes improving, and then whether it's a direct correlation, that has to be studied more. But they have improved their outcomes in those counties where RX Kids was implemented. I think there are ways that we could look at doing that in Mississippi that perhaps makes more sense and would be more strategic investments, but along the same line, looking for the same outcomes and perhaps more cost efficient and cost effective than what they've done in Michigan. Michigan's very different from Mississippi, as we all know, but it sure got my attention to see the change in outcomes and the specific counties where they implemented that program.
Yeah, and one of the things that he pointed to, he said he was not suggesting that we just start writing checks to expectant mothers that are in poverty situations, but perhaps a pilot program in a specific county or two where those infant mortality rates, to explore it further and see if
absolutely
the numbers from that study in Michigan would play out here as well. I feel like the reaction from our listeners was mixed. I mean, there were some that were like, oh yeah, more handouts. Why are we doing that? And others said, hey, maybe it is worth looking a little bit further and going with a pilot program, especially if it's, funded privately as opposed to coming out of the state's coffers.
Well, I tell you, there's already a lot of money coming out of the state coffers, mainly the federal coffers, trying to attack this problem. And, I'm preaching to everybody that, look, what we have been doing for the last 20 years is not getting us to where we need to go. We need to look at alternatives. So I commend Chairman Creekmore for being willing to look at alternatives and to think outside the box. I, for one, as a conservative Mississippian, am very happy to make investments to save the lives of babies. I don't have any problem whatsoever to spend $2,000 to give a baby a chance to survive their first year of life and have their 1-year-old birthday.
Well, one of the things that he said to us, and this was a direct quote, he said was, my initial thoughts are that this program is great. It comes down to can we afford it or can we not afford it, but we can't ignore it. It's proven successful and something I wanted to bring to the table. And I think that was maybe the point that he was underscoring when we visited was, I'm not saying that this is right for Mississippi. I am saying it's something that seems to be working in another place that's struggling, and it's a program that perhaps that we should look farther at.
Yeah, in terms of the money, let me put before y'all the cost to the Mississippi economy for our maternal infant mortality outcomes to our economy is $3.1 billion a year. Lost opportunity. That is real hard dollars that has been independently verified by multiple health economists. To invest a few million to reduce $3.1 billion in losses, that's good money sense to me.
Might be a good return on investment there. We'll continue the conversation with Dr. Dan Edney, the state health officer with the Mississippi Department of Health. Legislative agenda items as we get closer to the start of the 2026 legislative session. We'll talk about that next. Dr. Dan Edney is my guest, the state health officer with the Mississippi Department of Health. He is our chief doctor in the Magnolia State, and as such, you're involved with a lot of political workings as well. And it's hard to believe that we are now less than a month away from the beginning of the 2026 legislative session. In terms of what is on your plate, what is on your to-do list, working in conjunction with the House and with the Senate, what are some of your priorities for this legislative session?
Well, our main priority, we do need some legislative authority to help us in studying the deaths of our babies. Infant mortality review has been part of child death review in Mississippi since the beginning, since we started reviewing the child deaths. And we really need to separate infant mortality from child death review because they're very, very different, and we need some specific authority because as we study the deaths of pregnant moms, of babies, of our children, we learn so much. So it moves statistics into information that we can act upon. So we'll be asking some specifics there. One of the big issues that we're doing to mitigate infant mortality and maternal death is the obstetrical system of care, which is our fourth statewide system. And I tell everybody, look, we don't have the highest rate of infant death in the country because we have lousy hospitals and poorly trained doctors. We don't have enough doctors. We don't have enough OBs for sure. We're a rural state where things are spread out, and our system does not work very well for the sake of these really high-risk moms and babies. So the OB system of care is going to look at the problem the same way we do trauma, heart attacks, and stroke, to where the system is designed or redesigned to make sure that mothers that are high risk, that are delivering high-risk babies, are doing so with the right level of care and that they get to the right level of care as quickly as possible, which today is not happening very well. We expect that to roll out first quarter of next year, and we may need some legislative language to help us with that. We asked for level funding last year, and we're going to ask for level funding again because we've been working hard for the last 3.5 years that I've been state health officer to get our financial house in order internally and to generate revenue better ourselves, to get our overhead down, to have public health that makes sense for the 21st century. And that has been paying good dividends for the taxpayers of Mississippi, and we'll be asking for level funding once again. And part of that comes by getting fees in order so the taxpayer is not paying for the regulatory work that we're doing for private entities. So every year we get adjustments to those fees so that we can keep those programs at level funding and not be using taxpayer dollars to regulate folks.
You said adjusting overhead. Did you find when you came in, and not as a shot at anybody that was before you, that money was not appropriately being spent? I'm not saying illegally, but maybe just there were better ways to spend some of the money that was in place?
Yeah, and wouldn't say it was inappropriately being spent. It was being spent in old ways. And Dr. Dobbs knew that. And in fact, when he brought me on as chief medical officer, when he was state health officer, he did that because I had private sector expertise in running clinics for a long time. But every time we were going to work on it, we'd get another variant of COVID that would swamp us. So I knew that when I became state health officer that we had an inefficient public health system and that was very expensive to run, did not achieve the access to care that I wanted to see, nor did that he wanted to see. And also really stretched our workforce. And so we've been working that problem for the last 3 years and moving to a more consolidated regional model instead of just an old county-based model that doesn't work for anybody. It doesn't work for hospitals, doesn't work for clinics, and it doesn't work for health departments. And we're really starting to see nice dividends from that for the taxpayers.
Forgive my bluntness, but we are too fat as a state.
Yes, we are.
We can use other words like obesity and overweight and all of those things, but it really means we're not in shape and we're too fat. And projections show that by 2030, 57%, it's more than 1 out of 2 if my math adds up, of Mississippians are going to be classified as obese.
Very worrisome.
What are we doing?
So let me tell you what I'm very worried about.
What are we not doing, maybe?
Well, we're not moving, except we're moving our hands from the plate to the mouth too much, but we're not moving our bodies like we did, certainly when I was a kid. And my biggest concern is not just our obesity rates, but our child obesity rates. And that's going up. The last kids count report, I think we were like 42% of our children were seriously overweight. And adults are more like 35, 36%, which is way too high. But when we see children that are more than 42% of our children are significantly overweight, that is setting them up for failure with their health. And there are good programs to impact this. And part of our legislative agenda, we've been working with the Department of Education, other sister agencies. We rank 50th in health overall for our children, and I convened a roundtable back 6 months ago when the report came out to say, all right, before the legislative session comes up, what are 2 to 3 actionable issues that we can take to the Capitol to make a difference in the health of our children? And number 1 is working on health promotion, K through 12, not a health class, but health promotion to just teach our children just the basics of how to be healthy. And that means proper eating habits, proper activity, just the ABCs of being healthy as you're getting older. And we can do this. And that's probably the greatest investment we can make to improve the population health of Mississippi. It's too late for my generation, but it's not too late for my grandchildren.
One of the things that President Trump has pushed in putting back in place is the physical fitness test for elementary age children. Is that a worthwhile endeavor?
Yes. And, the governor issued an executive order putting that back in place and charged me and Dr. Evans at the Department of Education to write respective reports about how this needs to look and the impact on the health of our children will come about through physical activity, and it's just like, we took away driver's ed, and then we started seeing more vehicle accidents with teenagers and increased mortality rate with kids in car wrecks. And so we put driver's ed back in recently. We're just having to do the same thing. We're having to get mandatory physical activity back into the schools, but we've got to marry that with proper nutrition education. And those two things, just basic nutritional education with physical activity promotion, can revolutionize the health of our children, which will revolutionize the health of the population as they're getting older. But right now, if we don't change course, then in 30 years, we're going to have a tsunami of heart attacks and strokes.
All of this is kind of interconnected as well when we're talking about infant mortality rates.
Yes.
Did I read that correctly, that the leading cause of infant mortality comes from obesity in expectant mothers?
It does, and by a mile. So the highest risk for preterm birth in our state comes from unhealthy weight of the mother. 44% of our preterm births, the mother has an unhealthy weight. The next highest risk factor is high blood pressure. That's only 11%.
Oh, wow.
Of the preterm births, Richard. And then you go to diabetes, which drops to like 1.5%. Smoking is about the same. So, I mean, putting all the other risk factors together doesn't touch the risk of obesity.
But generally speaking, when you've got a mother that is obese while pregnant, she could very well have that diabetes issue or high blood pressure issue as well, right?
She likely will. But what we have to do, and this is where that K through 12 health promotion comes in, if you don't teach a young lady that being unhealthy with your weight puts you at risk of you dying and definitely puts the risk of your baby dying very high, she's not going to know. So we have to educate our younger people into these issues.
Dr. Dan Edney, he is the State Health Officer with the Mississippi Department of Health. Always enjoy the visits. Thanks so much for coming by.
Thank you so much.
We'll talk to you again soon. It's Dr. Dan Edney joining us this morning. Mornings with Richard Cross, SuperTalk, Mississippi. We've got more coming up with you. We're going to wrap up the 7 o'clock hour and then roll into the final hour of the show. Thanks for joining us. We're back right after this.